Hello, good morning. This is Dr. Jayanthi V. Sen, myself dental surgeon from Gadri Hospital under Gomati, Tripura. Here we're all assembled today to discuss on Mssska 8.0 and take training regarding this program, which is to be conducted between October 30th to November 6th, 2025. Coming to the definition of Mssska 8.0. This is a jointly implemented health program through a community based door to door approach as an alternative strategy amid the COVID-19 pandemic to sustain routine interventions. For whom is this program? It is for the age group of 0 to 19 years, and a major aspect on nutrition, immunization, and reproductive and child health are covered and are targeted. What are the programs under Mssska 8.0? We have 13 to 14 programs, that is Child Abha ID creation through UVN portal, Gram Sabha and special session on teenage marriages, that is TAM and EB, exclusive promoting exclusive breastfeeding, HBNC or home-based newborn care, HBYC or home-based young care, okay, for the young, awareness on teenage marriage and exclusive breastfeeding, AFP or acute flaccid paralysis surveillance, MR surveillance or measles and rubella surveillance, and post-COVID, again, the fever surveillance, and social awareness and actions to neutralize pneumonia successfully or SARS in short, TD10 and TD16 years vaccination or adult vaccination, Poshan Abhiyan or growth monitoring program, intensified diarrhea control fortnight or IDCF program, iron folic acid or IFA supplementation program, and vitamin A supplementation or VAS program, and final, the NDD or National Deworming Day. So let us study in detail. And before we go into this program, let us discuss who are the major stakeholders. By whom should these works be carried out? There are three important departments: the education, the health, and social welfare and social education department, along with the Swasthya Sakhi or TRLM group. Now, major stakeholders like education department, that is the schools, the teachers, the education department, health department, the primary frontline workers are the ASHA, the ANM, multipurpose worker or the MPW, the community health officers, ASHA facilitators, MPS or the multipurpose supervisors, etc. Now, Department of Social Welfare and Social Education, Anganwadi workers, ICDS supervisors, and the TRLM or SHG or Swasthya Sakhi. Now, what are the intensive public awareness mobilization programs done under Mssska 8.2? How do we do it? So, through mass media, mid-media, social media, interpersonal communication or the IPC. How? Mass media through newspapers, advertisements, radio, jingle, and TV, and mid-media through press meets, launch at state and district level miking, hoarding, posters, leaflets, handouts, sending SMS alerts by private telecom service providers, etc. Social media, that is the X handle, Facebook or Twitter and YouTube, and interpersonal communications, that is the door-to-door visit and surveillance by frontline workers or the ASHAs, sharing the short videos through WhatsApp, prayer sessions at the schools, the PTM or the parent-teacher meetings, the special awareness campaigns and programs, and impact on IDUs, that is the intravenous drug users or the tobacco control programs or the tobacco cessation product programs or the de-addiction programs, etc. And also promoting promoting the exclusive breastfeeding programs and abolishing the teenage marriages and pregnancy programs, teenage pregnancy programs. These are usually conducted at all levels in schools, hostels, communities, and mass gatherings, etc. Now, what are the leveraging existing platforms? We have the village or the urban health, the nutrition day, the village health nutrition day or VHND or the urban health nutrition day. We have village health sanitation committee or VHSNC, the Gram Sabha, the local clubs. We have school health programs, the parent teacher meetings, the Janani Arogya Samiti, the Mahila Arogya Samiti, and the self help group. Now, the list of activities, let's study in detail. The NDD or the National Deworming Day is conducted twice in a year. It's mostly on the 10th Feb and the 10th of August, and targeted to the age group of 1 to 19 years. And this is done mainly to control the soil transmitted helminthic infections and it's done by administering the deworming tablet or the albendazole tablet of 200 mg single dose for 1 to 2 years, and 400 mg single dose tablet for children above 2 years, and also for the adults. And this program is supported by the education department and the health department. Now coming to the IFA supplementation program, or the iron folic acid supplementation program, here again the education department plays a major role, and this program is targeted to the 6 months to 19 years age group. The iron folic acid supplementation is also done here, is done here. Then coming to the VAS, or the vitamin A supplementation program, this is harnessed for the 9 months to the 5-year age group, and vitamin A capsules, the vitamin A syrups are advocated and distributed to the school, and with the help of the education department, the vitamin A supplements are given to the children aged 9 months to 5 years. Then coming to Poshan Abhiyan, or the growth monitoring, growth nutrition and tracking, and seeing for any growth discrepancies are done under the Poshan Abhiyan program using the help of the district, state health and the education department. Now coming to the TD10, TD16 vaccination programs, this is a part of the tetanus vaccine immunization for the adult age group of 10 to 11 years and 16 to 17 years age group. Then coming to the measles, rubella surveillance, and post-COVID general routine fever surveillance. Here all age groups are monitored, and measles, rubella surveillance is the prime role. AFP surveillance, this is done for the children under 15 years age group, and this is exclusively for the polio surveillance to rule out acute flaccid paralysis. And coming to the HBNC or the HBYC programs, here the home-based newborn care is done for the 0 to 42 days child, up to home-based young care for up to 15 months. The newborn and young care children are harnessed. Now coming to the Child Abha ID UWIN app creation, here Child Abha ID is generated in the UWIN app for the 0 to 5-year age group using the mother's Aadhaar ID. Now coming to EB, or exclusive breastfeeding, it is done to promote exclusive breastfeeding for the first 6 months and post weaning until 2 years, and lactating mothers are trained in breastfeeding techniques, and also counsel them for promoting the breastfeeding up to the age group of 2 years. This is again done with the help of the health and the DISC department. Now coming to the SARS for controlling pneumonia successfully, here we have we target under the 5 years age group. Here we look out for the danger signs of pneumonia and refer the cases accordingly to the higher centers for treatment and management by the health team. Now coming to IDCF, here this is the intensive diarrhea control fortnight program done targeted for the under 5-year age group. Here we look out for the danger signs of dehydration, severe dehydration, and refer them to the higher centers for treatment, and immediate supplementation of ORS sachets to promote electrolyte fluid balance is done by the primary health workers. Then coming to the Gram Sabha, also here IDCF program, DISC health and the government ANM Anganwadi Kendras do a prime role. Now coming to the Gram Sabha teenage marriage and pregnancy programs are done to target the age group of all. Here awareness sessions at Gram Sabha, special parent-teacher meetings at the schools are done with the help of the Panchayat, PRI and the education department. Coming to the NCD, that is non-communicable diseases screening, the TB, tuberculosis, and drug abuse cessation programs. They're all targeted to all the age groups, and we conduct a lot of extensive information, education, and communication strategies and awareness programs and campaigns to rule out these harmful practices. Now, what is the support required from the line department? The Panchayati Raj institutions and the TRLM They play a major role for awareness, for bringing in awareness on teenage marriage and pregnancy at the Gram Sabha. They mobilize the beneficiary from community. The Labor Department also mobilizes out of school children and adolescents residing in the brick kilns and the tea plantations. The education or the special PTM on teenage marriage and pregnancy, the tetanus vaccination, etc., are carried out by the Education Department and Social Education Department. They promote Poshan Abhiyan program, the nutrition tracking, monitoring for nutritional disorders, growth discrepancies, etc., and promote iron folic acid supplementation and vitamin A supplementation programs. The ICA departments, again, this widely spread the awareness sessions and the campaigns. So this way, the Mssska campaigns are done all across the 8 districts of Tripura state, a joint venture for institutional engagement, complete community-based door-to-door outreach, Gram Sabha and special sessions, as well as counseling sessions on teenage marriage and exclusive breastfeeding, community-based door-to-door administration of drugs and supplements by schools or Anganwadis or degree colleges, vocational institutions, covering even hard to approach backward areas, dark areas, ensuring health to all. Now, looking into the Mssska 8.0 initiatives. These include Gram Sabha meetings, the targeted awareness sessions, and counseling focused on issues such as teenage marriages, promotion of exclusive breastfeeding, ABDM, malnutrition, AMB, promotion of non-communicable disease screenings, TB Mukt Bharat, and stop the drug abuse and substance use, and also tobacco cessation programs, the de-addiction center programs, and the stop alcohol programs or the de-addiction programs, and by participation of almost all in the community, including schools, hostels, and masses, and a special execution by all concerned team members of the health, education, social workers, and social education department at all levels. Now, the SNO, the NDD, and the AMD, the NRHM, the NHM will ensure issuance of joint directives as per the state stated timeline, and also facilitate prompt response in financial planning and execution as per the financial guidelines communicated to all the districts. Now, a state nodal officer, the NDD and AMD, NHM will ensure sharing of the draft program and financial directives with all the stakeholder departments as per the stated timeline. The district coordination committee meetings chaired by the DM and collector is crucial for improving planning of program activities, thereby enhancing overall effectiveness, coordination and implementation efforts. All the chief medical officers, the DNOs, will ensure completion of DCCM as per the stated stipulated timeline. The state shall actively engage relevant stakeholders, including the Panchayati Raj institutions, the Tripura Rural Distribution T as per the Tripura Rural Distribution Team as per the stated timeline. Now, how is the program management achieved? All the CMOs, the DNOs, to ensure sharing of the detailed micro plan of Mssska 8.2 as per the stated timeline. The planning and the review meetings by the involvement of DM and collectors is crucial for planning, implementing, and reviewing the Mssska 8.2 at the district level and for successful campaigns. All the CMOs and DNOs should involve district magistrate and collector for planning and review at the district level. The state health department should conduct a video conference with all the district level officials of stakeholder departments by the first week of October 2025. The SNO, the NDD, the ANM, the NHM to conduct video call as per the stated timeline. Now, adverse event management. The state, the district, and the PHC level healthcare workers, the frontline workers, the teachers to take initiatives for any adverse event at the campaign and to follow adverse event management protocol at the PHC level, the state level, and the unit level healthcare workers, the frontline workers, teachers, all to be vigilant for any adverse event. The coverage reporting, a mobile application to be developed for reporting at the CHO level by the IT department, in addition to hard copies, Excel sheets of Google spreadsheets, APP to be shared by PHCs with districts. All concerned team of health, education, SN, SE department at all the levels to ensure timely reporting of coverage report prior to the state. A pledge on no to teenage marriage in the village should be promoted. The capacity building and training. State level workshop, district level training, the block level or the PHC level trainings with 100% training attendance of all the frontline workers, functionaries to be done. Printing of IEC materials, leaflet, banner, training material, and reporting printed formats, prototypes given by NHM to all the district health departments to be distributed to below block or PHC level. Presentation of drugs and supplements, IEC, and reporting formats to be done. The key decisions are policy, drugs and supplements, program management, capacity building and training, printing, information, education and communication activities, monitoring and supervision, and coverage reporting are the prime criteria. The NCD screenings, the preventive strategies, the execution, the training and awareness programs and sessions are conducted to prevent and manage oral cancer, breast cancer, and cervical cancer. Apart from these, the National Mental Health Program and the National Tobacco Control Program, the National Adolescent Health Programs are doing a major prime role in adolescent health. End of my short talk on Mssska 8.0. Thank you so much.